That's right. Cervical cancer is the third most common cancer to affect women here in Malaysia. And we're going to learn all about cervical cancer today on the show. And we're very delighted to have Dr. Shantari Somasundaram, President of Medical Director of National Cancer Society Malaysia, here with us to help enlighten us about this cancer. So welcome on the show, Dr. Sound.
Lovely to be here.
Okay, let's first talk about cervical cancer. Where does it occur? We all know that cancer is an occurrence where there's an abnormal cell growth.
Yes.
Yes.
Well, cervical cancer is actually the lower 1/3 of the womb. If you think of the uterus,
yes,
the cervix is the lower 1/3, and that's where cervical cancer occurs. Now, when you talk about the cervix, though, if you think of the cervix, it's actually the Latin word for neck.
Neck.
So
okay,
if you think of it as a neck, you've got the bottom part and the upper part of the neck. And cervical cancer happens mostly on the bottom part of the neck, which is exposed to the outside.
Okay.
There are two different cells in the cervix. One is squamous and the other is columnar cells. And the area where cervical cancer happens mostly is at the junction between the two, which is what we call the transformation zone. And most of cervical cancer, over 80%, is squamous.
Yeah, we have a little bit visual here of this is the female uterus, as well as
Yes.
showing the cervix as well as the vagina walls.
Yep.
Yeah.
So if you look at that V which goes down, the cervix is right at the bottom of it.
Okay, so that is what is considered a cervical cancer when it happens in the female cervix, and it only happens to women because only women have cervix.
Exactly.
So let's talk about the cause of cervical cancer, because I've read a lot of articles saying that sometimes your personal hygiene, or wearing dirty underwear, wearing pads or panty liners can cause cervical cancer. Is that true?
A lot of people talk about tampons as well. Basically, no.
No?
Cervical cancer is nearly 100% linked to a virus, the human papillomavirus, or HPV.
Okay.
And that is sexually transmitted.
Okay.
Now, when we say sexually transmitted, we're talking about sexual contact, because HPV is a contact virus. It's a skin virus.
Okay.
So any sort of sexual contact with the genitalia area can open up an infection risk to HPV.
Okay.
Now, HPV is very, very common. We all talk about the cold, having the flu, etc., and how common it is. HPV is just as common.
Okay.
It is one of the most common viruses in the world.
But not some HPV viruses will lead to cancer?
Yes, only some will lead to cancer. So when you look at it, anybody who's sexually active, you will at least have one infection of HPV in your lifetime. That's how common it is.
Okay.
But there are over 100 different types of HPV, and only 15 are considered to be high risk for cancer.
Okay.
So even though so many people get HPV, less than 2% will go on to develop cervical cancer. And one of the things that linked to cervical cancer is a persistent infection, which means that instead of the body clearing the infection like normally it does, the body is unable to clear the infection, and the infection lasts for more than 2 years.
Okay.
Once you have a persistent infection, then there are cofactors which are linked to cervical cancer as well. And the cofactors is, again, sexual contact, having sex at an early age, having multiple pregnancies at an early age as well.
Okay.
And also things like tobacco. Tobacco is linked to cervical cancer as well. 30% of tobacco, 30% of cervical cancer is linked to tobacco usage.
Tobacco usage, okay.
But the things in terms
smokers.
of exactly smokers, hygiene has nothing to do with it. Hygiene, yes, in different infections, but not with cervical cancer.
Not with cancer.
Yep.
Okay, so you're talking about multiple pregnancies, and earlier on I actually asked you, and you said contraceptive use as well can cause cervical cancer. Can you help explain a little bit more about
oral
that?
contraceptive pills seem to change the hormonal balance at your cervix, which makes the HPV virus more susceptible to being a long-term virus and then linking up to cervical cancer. But it's a very, very small risk compared to the other risks, which is basically more sexual in nature, and tobacco. OCPs are considered a very, very small risk and shouldn't be a reason why you don't take it.
Yes. Okay, so multiple pregnancies, you were saying, does that mean that if you have more let's say, vaginal delivery of your babies, you're more susceptible, or the other way around?
Yeah, no, it's vaginal deliveries, but it's the whole idea of what we call the transformation zone. The transformation zone is the area where the squamous cells and the columnar cells meet together. And during pregnancies, and during that time of puberty, that area is more susceptible to HPV infections. That area grows larger, and so you're more likely to develop a HPV infection during that time. So that's why the pregnancies are linked to persistent HPV infections.
Okay, I see. All right, now let's talk about the symptoms, because I would say that cervical cancer is a pretty silent killer in that sense, because you don't really get a lot of symptoms until it's too late. Would you say that's the truth?
I mean, the unique part about cervical cancer compared to other cancers, and when you talk about screening, I mean, we all hear about screening for breast cancer, so you're looking for changes that say that you have breast cancer.
See the, like, you know, you can feel the lumps, you can, for breast cancer.
But that already tells you have cancer. With cervical cancer, it's the opposite. What you're looking for are changes before cancer happens. Because we've got such a long, what we call a latent period, which means that cervical cancer takes at least 10 years to develop.
10 years?
From your persistent HPV infection and your cofactor to the cells changing to cervical cancer, that takes 10 years. So in that 10 years, you can actually see the changes that happen before you get cervical cancer. So the beauty about cervical cancer is that if you do your screenings, if you do your pap smears, you can actually find it before you have cancer. And at that period, there are no symptoms. That's the silent part. In that 10 years, generally, there's very minimal symptoms.
And you can go from stage 1 to stage 4 and within that 10 years?
No, you're not even at stage 1 in that 10 years. That's what I'm saying. You don't even have cervical cancer in that 10 years. It's just that it takes that long for the cells to change and change and change until cancer develops. So that 10 years is what you call what we call the latent period, or that's your transformation period. And if you pick it up at that time, you can do something about it, and it's a minimal treatment so that you don't get cervical cancer. Once you do get cervical cancer, then yes, you will have the symptoms and you will have more immediate changes, faster changes during that time.
Because, what I understand from what you're saying is that you can get HPV infections possibly more than once in your life. And not all will lead to cervical cancer. So what are the difference between symptoms of HPV infection and cervical cancer?
Most HPV infections don't have any symptoms, but some of the symptoms that some people have, especially with a persistent infection, is that you can have discharge. Now, the discharge can just be thicker discharge than normal, or it can be a little bit more smelly, foul-smelling discharge. You can have a little bit of pain or bleeding in between your periods or with sexual contact. So those are the more common symptoms, if you want to put it that way. But those are also the symptoms for early stage cancer as well.
So, but those are also some of the symptoms for more, you know, like sexually transmitted fungal diseases like chlamydia and things like that. So how do you differentiate?
You can't. The only way you can differentiate is actually to go do your checkups. When you do have symptoms like this, go and see the doctor straight away. Don't wait. I think women get very, very shy. They're afraid of the stigma associated with sexually transmitted diseases and pap smears, and they wait and wait, you know, to see whether it will disappear by itself. But it won't. And what happens is that it actually gets worse. So as soon as you get the symptoms, go and see a doctor, get a pap smear done.
All right. It's as easy as that.
It is.
Okay. Do you have any data on, like, whether or not Malaysian women are, you know, how many Malaysian women out there actually do a pap smear?
Unfortunately, not many. Honestly, the statistics in Malaysia are horrendous in that sense, because we are a developing country. I mean, we are more than a developing country. We are considered a high middle income country. We have pap smears availability across Malaysia. It's very easy to go to any clinic and get a pap smear done. Having said that, our studies have shown that only 38% of women at the age group who are supposed to be getting pap smears have ever done a pap smear at least once in their life. Only 38%.
38%?
Once in their life.
Oh my goodness.
Exactly, exactly. And the reason why they're doing the pap smear is not because of the risk of getting cervical cancer, but because it's a post-pregnancy test that has been recommended by their gynecologist.
Okay. Shouldn't we make pap smear sort of a norm or a must do when you go for medical checkups? At a GP even?
It should be. Yeah. It should be. We are hoping that the government will adopt it as a national program where women at certain ages should be doing their pap smears at a regular basis. But I think there's still a lot of societal stigma associated with pap smears because of the whole idea, cervical cancer is linked to a sexually transmitted virus, so therefore you have to be a loose woman to get cervical cancer, which is absolute rubbish, at the end of the day.
How about, would young women who are not yet sexually active, would they get cervical cancer?
No.
So it can't be inherited?
No. Well, WHO has stated that nearly 100% of cervical cancer is linked to the HPV virus. So yes, genetics do play a part in it, but they believe that genetics play a part in terms of being a cofactor, not being the main causative reason for getting cervical cancer. But yes, if you have a family history of cervical cancer, then your risk is much higher. Okay. But the exposure to the HPV virus still has to be there. Okay. So that's why young women who are not sexually active, who have never been sexually active, we tell you, we recommend you to take the HPV vaccination. At least with the vaccination, you protect yourself against getting the infection in the first place. Okay.
So if you're already sexually active, you cannot get the HPV vaccination?
You can. You need to talk to the doctor about it to see what your risks are. It might not fully cover you compared to someone who's never been sexually active, because if you've already been exposed to the virus, it can't stop that exposure. Okay. It will just stop future exposures. Okay.
So if the exposure, the virus is from, genital contact, how about from the men's side?
It's the same.
Is it with, if you only had sexual relations with one partner and you caught cervical cancer, would that mean that the male partner is also susceptible to possibly prostate cancer or?
Not prostate cancer, penile cancer. Okay. Anal cancers, mouth cancers. It depends on where you have the contact with the virus. At the end of the day, it's genital with another part of the body. Okay. So whether it depends, I suppose, on your definition of what heavy petting is. Okay. But if you have oral sex as well, you are at risk of developing cancer in your mouth from HPV.
So would it mean that the cause is from? Would it be the infection is from your partner?
Yes, definitely. One of the risk factors is a partner who has multiple sexual partners as well. Okay. HPV is just not carried by women. HPV is carried by men as well. And men don't have many symptoms of HPV infections as women do, and the link to cancer is not as high. So as I said, cervical cancer is nearly 100% linked to HPV. Penile cancers are only linked in terms of 30% or 40%. So it's not as strong a link, but they are carriers. Men are carriers as well. Okay. And in certain countries like Australia, the HPV vaccination is now given to men as well. Yep.
All right, so young men who are not yet sexually active as well.
Yes, it's part of the national program now in Australia.
All right, well, thank you very much, Dr. Sound, for those very insightful and information. We're going to go for a quick break right now, but coming back, we're going to talk to a survivor about her challenges. So don't go anywhere.